Medical Center Ljubljana and Faculty of Medicine, University of Ljubljana. Can you hear each other?
Yeah, I can hear you.
Okay.
It's okay.
Please, the floor is yours.
My slides are in Slovene, but I switch in English because of prevalent language today. So I would like to express my gratitude to organizers first. Then I have to admit I'm not a researcher. I'm clinician. I'm maxillofacial surgeon, subspecialized in orthognathic surgery. That means that I deal with dentofacial deformities. The most frequent dentofacial deformity in Slovenia is so-called skeletal clustering, and one case of this deformity is presented on the slide. The primary goal of orthognathic surgical procedure, and these are bony procedures only, is good occlusion. That means good bite, because this is demand for good orofacial functions as biting, chewing, as for speech, and so on. And this can be achieved by different bony surgical procedures, and they should be followed by harmonious facial aesthetics. Please press the enter, so you can see with surgery we present good bite and good aesthetic. Please press enter. You see the same patient after our surgery. Let's move to the next slide, please. Traditionally used methods for diagnostic and evaluation of these patients are clinical exams, photographies, and lateral X-ray cephalometry that's presented here. But you can imagine these are two-dimensional methods and quite subjective ones. Press enter, please. Nowadays, with 3D surface optical scans, we can do many analyses in more objective way. These methods are different and many. One, as presented here, is with determinations of a reference point on the facial surface. They allow us to determine distances, ratios, angles to describe the face and also their changes after surgery. And press enter again, please, Mr. Lutman. And we can split the face also in different areas to determine and facial compartments separately and more accurate and precisely. Let's move to the next slide. It is the fact that a few years ago it was not objectively known how soft tissues react to bone movements, because it is clinical fact that they are not changing in the same ratio. So our question of this study was, what is the ratio of soft tissue changes regarding to bone movements? And this is, we did many comparison, pre-post. You see color maps, please enter. And we actually calculate these ratios, and we found out that this ratio is smaller than we expected. And it is fact that soft tissues follow bone movements at most for half and different in different facial areas. That was a result of our study published in our good review in 2017. But even maybe more important for us was that we also once again confirmed our results published in 2014. We were first group on the world published in that facial soft tissues react as one unit. That means that soft tissue changes occur also in the areas where underlying bones were not changed during the surgery. And that was very important data for our field of surgery. Thank you for your kind attention, and I'm happy with questions.
Thank you for your nice presentation. And now we have a question section. We don't have any questions. Thank you again.